For most New Zealanders who now test positive for COVID, your care and recovery will be in your own hands.
That's something they've been learning in Australia and India, where a home care video has gone viral. We tracked down the Auckland GP, whose online advice has been a global hit. Into our third year of COVID, with 2 variant outbreaks in Aotearoa. It's work, school, and life as normal, as much as possible. But if you test positive, in most cases, you'll be confined to your whare. One Auckland GP's mapped out the must-have items for a COVID home care kit in a YouTube video. It's helped thousands of people here and abroad, won her a community service medal, and now she's hoping it'll help you too. And Dr. Sandhya Ramanathan is here now. Great to talk to you. We know painkillers, throat lozenges and tissues are a must. What else do we need? I mean, is a pulse oximeter really necessary?
Simple over-the-counter remedies for things like sore throat and runny nose are definitely worth having at home. In terms of equipment, you mentioned a pulse oximeter. This is a little device that looks like this that you can buy online or in a pharmacy. It would be nice if you can get one per whānau would be good. They're available online for around between $20 and $40. Some of the smartwatches and wearables do have an ability to read your oxygen saturation, and the ideal figure is over 95%, but it's nothing that you need to stress about. A thermometer would be useful as well. And then just, some other general things like cleaning products, plastic bags, gloves, masks, of course, and maybe some non-perishable food items that you can keep in your pantry and some frozen meals, just in case that you and your family members have to isolate.
And for those who share a house, and I'm thinking specifically of the kitchen and bathroom, especially with other people, how can you minimise transmission?
So you have to really think carefully. First of all, think about where you would keep the infected family member. Preferably, if you're able to, they should be in a room on their own. And if they have a bathroom that they can use just for their use, then that would be ideal. If not, then it's okay. Just make sure that your house is really well ventilated. Think about things like having a fan, which you can point out a window to help with cross ventilation. You can think about purchasing an air purifier, and they are very effective at removing, cleaning, indoor air by removing over 99.9% of aerosols in the air. The other things in kitchens and bathrooms are extractor fans, and just making sure that that there's good disinfection and hygiene practices. But most importantly, making sure you've got a good stock of good masks.
And Sandhya, a lot of people will be wondering, ahead of needing to pull out a COVID care kit, is there any way that they can build up their own general health?
A well-balanced diet with, rich in fresh vegetables and fruits from all the different colours of the rainbow, avoiding processed foods and junks, drinking water, avoiding alcohol and sugary drinks, and also making sure that we are doing regular exercise, at least 20 minutes a day if we can fit in. And it's also really important that we stay connected with our loved ones, because loneliness is very bad for our immunity, and just staying in calm in general.
Thank you so much for your time tonight. Some really wonderful advice there. Take care.
Thank you. Thanks for having me.
ASB and 7 Sharp, keeping you one step ahead.